Thank you for your time today, and welcome back to our program here.
Thanks for having me, Bill.
How would you characterize the possibility of success for this health care bill today?
Very high. I think the Senate's taken a remarkably positive step forward. Senator McConnell has continued to work with his members to make sure that we improve the bill that the House passed over to it, and I think we're going to move forward and get this done as both the President and the Majority Leader in the Senate have asked for.
Well, I was going to ask you to put a number on it. I was going to say 50-50, but that answer tells me you're higher than that. Well,
I am.
Well, give it a number, Sean.
I don't. Look, here's what I'll tell you. I think when President Trump wants to get something done, it's going to get done, and I think no one knows the Senate better than Senator McConnell, the leader over there. So with that combination, I think we're going to get this thing done, put it in conference, and hopefully by the August recess, really have Obamacare repealed and replaced and be on the path to affordable and accessible health care as the President has promised.
So what is the White House strategy then, Sean? Are you working hour to hour, day by day with Mitch McConnell, or are you leaving it to him for now?
Well, the President, Secretary Tom Price, Seema Verma, the Center for Medicaid and Medicaid Services, and our Legislative Affairs team has been providing technical assistance and working with members and Senate leadership to talk about additional changes that might not be necessary. But we feel we're in a really good place right now, and we look forward to, as Senator McConnell has talked about, a vote next week.
Former President Obama does not like this. He wrote this on Facebook on screen. Simply put, if there's a chance you might get sick, get old, or start a family, this bill will do you harm. And small tweaks over the course of the next couple of weeks under the guise of making these easier to stomach cannot change the fundamental meanness at the core of this legislation. What's the President's response to that, John?
Well, the real meanness is allowing the American people to believe that that Obamacare is still alive. Obamacare has failed. In county after county, they are left with no choices, rising premiums and skyrocketing deductibles. Obamacare is dead. It isn't an option, and I think we need to face the reality of that. When people want to compare this bill with Obamacare, it's an unfair comparison because Obamacare is not doing what it proposed to do. It has failed the American people. Most people who still have access to some of it can't afford it. So what this bill does, frankly, is deal with the reality. And if you look at the rest of the majority of where the Democrats, especially in the House, have done, they've signed on to a multi-trillion-dollar single-payer Bernie Sanders government-fits-all single-payer health care system. I think that's the alternative that we need to talk about. The reality is that this bill provides accessibility and affordability to the American people as they were originally promised and as President Trump is finally delivering on.
But you know
that's
phrase,
the real alternative.
The fundamental meanness from President Obama is what Democrats are going to point to. And there was a report that the President thought the House bill was mean. Paul Ryan the other day on our program said that was a misinterpretation. But the fundamental meanness, just react to that phrase.
I don't know how it's mean to provide people health care, and that's what we're doing here. The President, as I said, made it very clear that he wants to make health care not only accessible, but affordable. To give someone a card that is useless because you can't afford to get care, you can't get in to see a doctor, doesn't really mean anything. And what the President's committed to is making sure that people have health care, that he understands how crucial it is to people and their families when they get sick to have the care that they need and in a way that they can afford and doesn't cripple them with skyrocketing bills. So this President's actually delivering on it. I understand that some Democrats that fought so hard for Obamacare are clinging to it. But the reality is it's an unfair comparison because Obamacare has died. It is over. It is in need of its own health care. Right. Luckily, we are coming to the rescue on that.
Let me move on to another topic. Topic of the day, Comey tapes. We know they don't exist now. Democrats say the President was trying to intimidate James Comey. Was that the intent a month ago, suggesting there was a recording?
No, quite the opposite. I think the President made it very clear that he wanted the truth to come out. He wanted everyone to be honest about this, and he wanted to get to the bottom of it, and I think he succeeded in doing that. The reality is that he wanted to make sure that the truth came out, and by talking about something like tapes, made people have to, made Comey in particular, think to himself, I better be honest, I better tell the truth about the circumstances regarding the situation. As you heard, the President said that on Director Comey's watch 3 times he was told he wasn't an investigation. That turned out to be true. Despite the false reporting that had come out that said Comey was going to do it, he came and testified under oath that, in fact, he did do exactly as the President had said so. He had been honest and told the President on 3 separate occasions that he was an investigation. And what we know now is that there was no collusion, and that the only person who actually leaked was, in fact, Director Comey.
Okay. Sean, I'm out of time, but I want to thank you for yours. By the way, your new job, When does that start, and do the briefings end for you?
No, we're continuing to proceed as following. I wouldn't read everything that you see in some of these Washington-based publications, but we're continuing to fight hard for the president's message, agenda, and priorities, and we'll continue to do that every day.
Okay. What was in the cooler last night?
What was in the what?
The cooler.
The cooler. There was a bunch of guys that were covering the president and the first lady have phenomenal congressional picnic where they paid tribute to New York City, and I wanted to make sure some of the folks in the press corps got to enjoy it as the bipartisan group of members of Congress.
A lot of Miller Lite. Thank you, Sean, for your time. We'll talk soon.
You bet.
Sean Spicer, North Lawn. Thank you.